Hey, this is Dr. Andrew Oteo with Stonebridge Health. You're watching the Stonebridge podcast, and we're going to talk about health, wellness, and everything in between.
So my name is Dr. Tyler Middleton. I'm a physical therapist. I partnered up with Dr. Oteo back in 2018. So now we offer chiropractic and physical therapy. That way we get our patients back to normal faster.
You know, we started a collaboration together 4 years ago, and it's amazing. We just kind of talked about that as well, too, of how much has changed over the past 4 years. But the amazing thing when we kind of look at healthcare as a whole is we're starting to see kind of that whole emphasis on collaboration, of working together. And I know previously kind of talk about your history. You've worked in a collaborative environment as well.
Yeah, and like we were talking about earlier, if you're not growing, you're dying. So, just having chiropractic where people have to go to a separate clinic, then go into PT as a separate clinic, why not put everything together? I love working with chiropractors because you guys do such a good job of getting people into alignment. I mean, there's so much more that you do, but on the PT side, then if we build strength and stability and we can keep a patient from, sliding out or just being fixed for the rest of their life, that's huge, So patient education too on both sides, like the way I hear you talk to patients, the way I talk to patients, I feel like people get more out of it, so it's more beneficial. And I always joke around about saying, hey, we want to turn you into a mini physical therapist. So that way you know how to fix things throughout life. So I think it's been great.
Yeah, I think so we grow a lot through pain points, and I think when I first opened the practice, there's a lot of patients that I wanted to help. And I was like, man, I wish I could spend an hour with this person and, do these different corrective exercises. But at the same time, there's certain things that, we kind of have to look at in terms of limitations. Yeah. Bringing PT on was just kind of a natural extension from us. And that was one of the things. So we talk about like different types of patient cases, like somebody comes in with OA in their knee, osteoarthritis, wear and tear, degenerative change with their knee. Chiropractic care, obviously, we can look at your hips and lumbar spine. We can look at your ankle. We can look at different mobility points. But sometimes like mobility through the chiropractic adjustment can only go so far without that added layer of stability,
For sure.
And that's truly where you guys shine. Like that's the thing too. If you can speak to that a little bit of like how like you evaluate a patient and then what things you look for in terms of adding stability.
Yeah, and so like you said, building stability, that way patients don't continue to have unstable joints that are causing pain and wear and tear. So with physical therapy, I try to keep it really simple. Pain is the first thing we got to focus on, then range of motion, strength, and then function. So before you start to build strength, you got to cool things down. Work on getting patients' pain to a certain level that they can do normal daily activities without pain, So then we focus on getting people stretched out, working on long, strong muscles, and then get them back to those functional things, whether it's, just want to be able to walk up the stairs. I want to be able to do laundry, for a whole day without hurting the next day, or people that want to run a marathon for myself, an Ironman, so it depends on how crazy you are. So
he's pretty crazy. An Ironman, if you wouldn't mind, I don't know if you guys are familiar with what an Ironman entails. If you want to just tell a little bit about what that is.
Yeah, so I had a hard time. I've always played football, baseball, wrestling, and after you get to a certain age, your motivation levels just kind of start to dwindle. So I started picking up triathlons, and an Ironman is considered like the highest distance where you do a 2.4 mile swim, then you have a 112 mile bike, and then you have a full 26.2 mile marathon. So it's definitely taxing on the body. It's one of the hardest things I've ever attempted. And they also offer a half Ironman, which is a little bit easier. You just cut all those distance in half. So in terms of wear and tear on your body, I'm glad I work in an outpatient clinic so I can fix myself or have people work on me. But it's definitely a challenge. But again, that's just one thing. That's my functional goal, whereas everybody else's goals are different. So,
and just like you said, sometimes we have people that come in and they're like, hey, I just want to be able to lift my grandkids. Like, I want to be able to walk upstairs without having like this instability that I constantly feel like I'm about to fall, So, and that's like you were kind of saying like of order of operation of like what we look for with a patient. But the very first thing we do is we sit down with patients knee to knee, we talk to them, and we say, hey, Mrs. Jones, how can we help you? How can we meet those expectations? I think that's such a critical thing because, it's kind of a weird thing to think about, but like in healthcare, sometimes what makes us different is we grow relationships with people. We treat people like people. And unfortunately, that is a differentiation point to some people that weren't treated that way in other clinics too.
Yeah.
So
Yeah, and treating people like family, everybody you hear say, hey, yeah, we treat people like family, but being genuine. In fact, you just got a compliment. I was at a luncheon before I got here, and people talked about how Dr. Oteo actually sits down. He listened to me. Yeah, sure, I told him I had plantar fasciitis, but he said, we're going to fix this, and we're going to really help you with your feet. And he just felt like at home because he said he's been to several chiropractors, but you actually listened to him. So it was a great compliment.
I had another patient come in yesterday that was joking around about how every time they come in, they're like, he always puts a smile on my face. He's always joking around. He's always high-fiving. And, so that's the thing too, is if you have to go to an outpatient clinic, if you have to go to a place to get rehab, to get, taken care of, number one is you want to feel like they actually care about you, right? So you're seeking care and you want to hope that that provider has some care for you as well.
Yeah.
But at the same time, like, you want to be engaged with what you're doing, have something to look forward to with your visits as well too.
For sure.
If you got to go anywhere twice a week or once a week or whatever it might be, you got to at least maybe look forward to what you're doing there,
Yeah, I mean, and I try to tell younger students, they say, hey, why do you want to be a physical therapist, or what got you into it? And I tell people, anybody can get the job done. But if you're just telling somebody, raise your leg, do this, do a squat, you want to have fun doing it. You want to make it interactive. You want to educate. You want to try to give them the whole package, and people can see our passion. So, and I think that's what translates so well to our success is, people are seeing like, hey, we generally do care. We try to turn you into that mini PT or chiropractor, and people have been very responsive. So it's been great.
And I think a lot of, we were talking about like growth through pain points and how, in our office, we had pain points of just having chiropractic and having those limitations of how we could help people. But in our own personal lives, I think we both had pain points as well too. You've had a slew of knee injuries.
Oh yeah.
And I think that's kind of what led your journey to physical therapy too. So if you want to kind of touch to that as well.
Yeah, unfortunately, after college, I continued to play sports without training, not smart. And it led to 2 ACL complete tears. I had both repaired. I've had a total of 5 knee surgeries between mountain bike accidents and, again, sports-related injuries. So going through that pain, I think, helps to, empathize.
Empathy,
Thank you. It helps to kind of get on that same page with your patient so you can tell them, hey, I've been through this. I understand going to sleep after surgery when everybody else is sleeping and the house is completely quiet, but all you're thinking about is that throbbing pain. It helps you to cope with the patient, help them to better, I guess, help themselves, know about these things ahead of time. That way they can get through it a little easier. So,
it leads to like depression. Like, we have patients that come in. Sometimes we've had patients walk through the door that are like rude and mean and just short with us. And like, we never take that personally because there's an emotional component to pain. It's not just the physical component of like an ACL tear or like a meniscal injury or, cervical radiculopathy. It's like, people are more than just a diagnosis, and that's part of the thing that complicates it is, we got to make sure that we're building trust with people as well, because number one is, we can use a lot of fancy terms and diagnosis codes and ICD-10 and all this other stuff, but people ultimately want to know that we care about them. And I think you hit the nail on the head when you say like we relate to them and understand what they're going through, because injuries are a real thing and we're not immune to those as well. And so we practice what we preach when it comes down to that.
I think our greatest trait is empathy, so we have quite a few students in our practice. We love to teach, and, the students keep us sharp too. They teach us new things because you're never tired of learning. But I was speaking to our student last night, and we had a patient that came in and was being a little, I guess, under the weather, or just wasn't being very receptive, exactly. And I said, hey, listen, you got to kind of brush those things off. You got to make sure you're telling them, hey, we feel what you're feeling. We know what you're going through, but just hang in there and try to get through to them, because we know pain makes you grumpy. I used to be a wrestler. You go 2-3 days without eating. I wasn't the nicest person to deal with. So, but yeah, so.
Even still, if you don't get a snack, you're grumpy.
Oh my gosh, yeah, that hangry. I get very hangry. But yeah, so it's been a great, with PT, again, my favorite thing about it is you get to work with patients, you get to see them get better. So it's a fun process.
You also, you hit a good point of like our interns, and a little bit about that too. That might be a little bit confusing. So I'm a doctor for the community-based internship program for Parker University. And so that gives us interns from the chiropractic side, but you also have physical therapy assistant interns as well
Yeah,
too.
so we're partnered with Concord Career College, and they have a PTA program. So we'll take students from their PTA program, and then we can help them kind of get through each rotation. They do a total of 3 rotations. So they're with us for a short period of time. It's only 6 weeks, but we get to help them kind of develop. And it's fun, I joke around because I love Ted Lasso. I think Ted Lasso is a great program. And watching him pull the best out of each personality and different person, that's what we always try to kind of hit home the most. How can you help these students grow depending on how they excel and how they kind of lack? So it's been great.
Yep.
It's
I
really
think
good.
it helps us a lot as clinicians too, because it forces us to like really evaluate different things, and these students are incredible about bringing in like new technology that's
Mhm.
happening and really understanding what's on more of the bleeding edge of healthcare right now
Yeah.
too. So
Yep. Yeah, and I joke around like Dr. Oteo had his practice back in 2016, and I didn't know Andrew from Adam until I actually met with another group of people, and they asked me, say, "Hey, do you know Dr. Oteo?" And I'm like, "No." And so they gave me his number, and they said, "You need to call him because I was looking to start my own practice. Dr. Oteo already had his chiropractic practice established, and when I cold called him, he's like, 'Hey, I'm going to the clinic. Meet me over there.'" And from the first 5 minutes of meeting him, I could tell we had the same drive. We're kind of like brothers when it comes to business. So
yeah.
adding PT to his practice and me being able to add, have my own PT practice with chiropractic, it's just been great.
hmm
So um,
And I always truly like I always believe nothing happens by accident. Things are put whether they're good, bad, or indifferent. I mean, these are all things that help you grow. And I truly believe like, us coming together was
yeah,
no accident,
yeah,
and us having this amazing growth has just been like truly one of the things that I always talk to people about is the name Stonebridge. People always say, "Why did you come up with the name Stonebridge?" I was initially going to open the practice in Stonebridge Ranch in McKinney, Texas. And so literally when I walked into the building buying equipment, like the building that I'm in currently, I figured, I was going to go there, purchase equipment, be done with it. But that truly became a tap on the shoulder, and I felt God was leading me in that direction to open a facility there. So literally overnight, I changed my business plan from McKinney to the Colony.
that's crazy.
And I feel like it was kind of the same situation with us when we met. I was like, okay, PT was on my radar, but I met the right person at the right time, and like, let's do this.
Yeah.
So
Yeah, and the practice was 5 minutes from my house, so like I said, it couldn't be any better. So,
mhm.
my wife, she was all for me, kind of going all in, and she met Dr. Oteo, and of course, anybody that knows Dr. Oteo knows that he's your favorite person. He's the nicest gentleman you could ever meet. So she's a big fan of yours. So,
Yeah, it's
yeah,
been incredible. And, we've been in practice for 7 years now. It's amazing to see the growth, but really when I look back, it's, one of my favorite personal things to do is to look at our reviews online and read some of those different stories,
yeah,
because truly beyond just us being able to, grow the business and have more people that we employ and, do stuff for the community and give back in different ways. The thing that I'm most proud about is just making a change in people's lives.
yeah,
That's the thing that
yeah,
I really, really love. So,
yeah.
um,
One thing I think you should talk about too. We had the gentleman at the luncheon that I just left. He was asking. He said, "Hey, what's different between you as a chiropractor versus other chiropractors? Or is there a way that they can do an adjustment without getting their hands on it?" And I said, or he was asking me really. He said, "Which way do you do chiropractic?" And I was like, I didn't know how to answer that. So I said, "Well, what do you mean?" And he went into further detail, like, "Hey, do you just do this, or you just lay people down on the table and crack?" So if you can give them a little more
yeah.
information about how our chiropractic's different.
So at Parker University, they go through and they teach you 9 different chiropractic techniques. So some of those are manual adjusting, popping, clicking. Some of those are laying on the table, drop pieces. Some of those are using an instrument, a little clicker tool. And so I think everybody kind of goes through and develops their own type of technique and things that they align each patient with. We do more of what's called diversified. So if I were going to give you the Andrew Oteo technique, it's mainly diversified, which is a hands-on type of adjustment. We do some tops and drop technique, which is where we do part of the adjustment with the drop table. But some patients also prefer more of like the instrument assisted adjusting. And what we've brought on is actually, it's called the Pro Adjuster 360. it's like a computerized chiropractor. So some people that are like, I don't want popping, twisting, all the snapping that goes on involved with that. Nowadays, like it's actually, people watch these videos online. They see like, oh, the ring dinger or the Y strap. And so sometimes that's a good thing for chiropractic because people are at least exposed to like more of the manual adjustment. But sometimes it also turns people away from chiropractic because they're like, I don't want anybody pulling my neck like that too.
Right.
I'm just going to clear the air. We don't do the ring dinger in our office. Okay. So that's not something we're going to do. But at the same time, we do manual adjustments and people come in because they want the types of results or they want results, period. And so that's our main thing is we try to align the technique that we use with what's going to be most effective for that person's spine, so, and typically it's a combination of care with that stuff too, but, and that's the same kind of thing with you. There's different techniques even within the physical realm of PT. But
well, that's why it was hard for me to answer that question to the gentleman because I didn't really understand. Because when I do watch him practice, he's doing everything, So I said, well, there's different ways to do it, and it's not just one way. And he's like, oh, okay, good. So
that goes into the spa of care. We always call it SPA. That's the science, the art, and the philosophy, or the science, philosophy, and art. I guess you're saying spa. So, but there's an art to what we do. There's an art to what you do as a physical therapist. There's obviously it's evidence-based and science-based and all that stuff too. But, the reason why there's different art forms is because doctors have different philosophies behind what they choose to do and why they choose to do it, So that's the part, I think a lot of people gravitate to is I think the type of philosophy we have is kind of a no-nonsense approach. It's like, let's get results, let's focus on pain, but really build towards maintaining your health for the future,
Yeah, I believe the same way. I think you need to get your hands on every patient. Even though you could get 10 diagnoses that are total knee replacements or total hip replacements, every patient is different. In fact, in class, when I was back in my doctoral program, which is a long time ago now, they would teach us, they would have you kind of split up into groups and they would give you a bag of lemons. And each person took their lemon out of the bag and you got to palpate your lemon, and what you're thinking is you're treating it like a person. So you're like, oh, my lemon had a little cut on the bottom. So I'm like, oh, that's a herniation on the bottom right quadrant, and then once you were done palpating your lemon, you put your lemon back in the bag. They blindfold you or turned all the lights off. One person would grab the lemon, palpate their lemon. If it wasn't theirs, they'd pass it on. And again, the idea was that even though you have the same diagnoses, each person is completely different. And to this day, I still have my lemon. It's brown and orange. It's gross.
It's
but
I'll never lick it and just kind of remind yourself of school.
I'll never let it go. So it's just that one stuck with me pretty well. So. Yeah.
Well, I had a lot of fun today, Doc. I appreciate you always, and it's been one heck of a journey, but you know what? The cool part is it's just begun, and healthcare is ever evolving, ever changing. We're always bringing in new stuff and kind of bringing new ideas. And the whole foundation of it is, number one, we're trying to build, more value for our patients that come in. Number two is we're trying to be more bulletproof in compliance and just making sure that we're creating a gold standard for what we're doing. But number three is we're trying to build something that's sustainable that truly will help more people in years to come. So,
absolutely.
But thanks for joining us and learning a little bit about Stonebridge.
No, thank you. Thank you for having me. It's been a blessing.
Absolutely. And, we look forward to sharing more and, diving deeper into some of these different things. And we want to know what you want to hear more about as well, too. So, but thank you for joining the Stonebridge podcast. We'll see y'all soon, okay? God bless.
Thank you.